Hello, everyone, and welcome to the podcast. I'm so excited to feature Dr. Joanna Claustro today. On our podcast here, we always feature local business owners, entrepreneurs in the Northern Virginia area. We talk all things business, sales, marketing, and entrepreneurship. So I'm so excited to have you on today. Dr. Claustro is the sole owner and CEO of a boutique dental practice in Ashburn, Virginia, where she specializes in functional and cosmetic dentistry. She has over 11 years experience. She offers comprehensive care that connects oral health to overall wellness, including preventative, rehabilitative, and cosmetic services, along with facial aesthetics. Dr. Claustro's one of the top DMV's dentists, celebrated for her expertise, kindness, and community involvement. She's a faculty member with the Clinical Mastery Series and a leader in advanced dental education, and frequently speaks at industry events. Her state-of-the-art practices feature advanced technologies like digital imaging, AI diagnostics, supported by a passionate care team. Outside of dentistry, Dr. Claustro loves going to concerts, Wolf Trap Farm maybe, as
You
well
may have
as
seen us.
as well as traveling with her husband and 7-year-old son. Welcome to the show, Dr. Claustro. Thanks so much for coming on.
Thank you for having me, Dr. Brassfield.
Absolutely. Thank you for coming on. Well, you've had a very unique journey as well as a unique personality, as we all know, and we are going to learn. So I'd love to learn more about you being born in the Bronx. I know that you grew up in, Southern Virginia, and just kind of tell us a little bit about yourself, how that shaped you today, and kind of both as a person and becoming a professional dentist today.
Well, yeah, when you've worked this hard and you're this old, it's nice to be asked about kind of the roots and the beginnings, right? Like where you come from and how that shaped you. And for me, um, I was born in the Bronx. My parents immigrated here to the US from the Philippines, and that's where they did a lot of their studies. I don't remember much of the Bronx, but I remember growing up and being like, yeah, I'm from the Bronx. So the truth is that at an early age, at 3 years old, my parents, both physicians, had the opportunity to move to a small rural community in Southwest Virginia. And that is where I spent all of my formative years. And it was a small town. So we grew up with the small town values. It was unique too, though, because we were also one of few foreign families that lived down there. So it really gave me a different perspective. As I got older, my parents decided that, you know what, we want to give our daughters a little bit more access to the world and for more diversity. So I was very lucky and was able to attend the Madeira School for Girls here
Whoop,
in
whoop.
McLean. Whoop, whoop, what
Go,
fences?
go, go
And
Madeira girls.
go
Go
Madeira
Madeira
girls.
girls.
We're strong and so strong. But it was really fantastic. It's hard going at such a being it's hard being sent away, right? Because that's what it feels like. And that's what it was. Like, it was hard to be sent away at such an early age. I was 14, maybe 15. And that was hard. And I was meeting people of various backgrounds, socioeconomic, from all over the US, of different races and backgrounds and religions. And it was a bit of a shock to me. But what really was very important to me was just the kindness that these girls had and the bonds that we still have today. So, like 25 years later, I still am so close to so many of these women who we grew up together. And the values that I were instilled in me at that time, and the values that I kind of experienced for myself, to always treat people with an open mind, because I feel like a lot of my classmates and fellow boarding girls, they extended that to me. I was shy. I mean, seriously, shy. You
I
would
would
never believe it,
never,
right? Like,
never believe
never
it.
in a
Nope.
million years. I was shy, an awkward chicken, and I really had a hard time finding a place to fit in until I kind of got there, right? So it was just really, really great. And um, I think having gone to an all women's school at such a young age, I learned really quick how important it is to raise each other up, because we were not immune to it. We could see and experience how quickly we would tear each other down as young girls, especially when we don't have parents to like keep us in check, right? We were raising ourselves and each other, but when you live in such close proximity to each other, you also realize that you have to find ways to come back full circle, admit when you were wrong, or admit when there was a miscommunication, and understand when you know when someone's in pain and they're not necessarily telling you the full story. So that, I believe, is probably the most important time in my education, right?
Yeah,
And it helped me, challenged me to become a better writer and all of this stuff, just because of the level of education the school provided. So I think I look back at that time and I realize, like, I'm more like that 14-year-old girl now actually than I ever was, because when you're in a business realm, you have those vulnerabilities too, and you have to realize you have to think in such a way where you're like, okay, each day is new. Each opportunity with a new patient for me as a dentist is new, and you have to say, okay, what histories do they share? Right? Just like I was in a dorm room learning the histories of these girls from all over the place and understanding that they have different values or different experience or different fears and different anxieties and different goals. And it was my job as their community member to celebrate that and help them raise up themselves. And I do that now in my practice every single day. And
absolutely. How do you, what a unique experience to go to boarding school because, obviously some of us, majority of people go to public school. Some of us are
right.
fortunate enough to go to private school, but boarding school must have been totally a unique experience, which obviously, formed the person you are today.
Yeah.
How do you feel, if any, that led you, into dentistry?
So I'll be honest, again, being a daughter of two um, physicians and being Asian, there's always that pressure, right, Keith, to do the pre-med route.
Yeah.
And having been sent away, I kind of developed my own independence. I'm like, I have my own brain. I have my own. In high school, I wanted to write screenplays, right? Like, that's normal. And then when I went off to college, I went to Skidmore College for my undergrad, and I hesitated. I resisted. I didn't do any pre-med. I didn't do pre-dental. I actually um, studied computer science because it was the early 90s, late 90s, and that was a great field to be in. And there just happened to be a really cute boy in who was taking computer science classes, and I just wanted to spend every moment with him. Um, Thankfully, I am married to him, Bob, and we have adorable Hudson. But what that did, when I was in school, all jokes aside, I loved learning, right? That is what my background or my experience at Madeira, and for me, I did not get that in my public education in my small town where I grew up. I didn't have the confidence to go after anything like that when I was in that public school setting. So I'm not discounting that either. But for me, so when I got to college, I loved learning so much. I was that overachiever, though. I might not have been pre-med, but I was like, I'm going to minor in three things. So business, expository writing. I did like I took dance and horseback riding. I did all of the things. And what that helped me in hindsight is it gave me perspective. When I do talk to other people, my patients now, I didn't, after graduation, I actually went into marketing and was a graphic designer and worked for a nonprofit medical company, or medical, not company, but a medical like association.
Mhm.
And at the time, my brother-in-law, who is about 6 or 7 years older than me, it was in dental school, and we went to go visit them in Boston, and Scrubs was really popular. So it was just, I went and I visited them, and I was like, look at all these people. It's just like they have in the show. Everyone's like dressed the same way, talking the same way. And even through my work with the nonprofit, organization, I appreciated the opportunities in medicine, in a medical field, to always keep learning, right? Like, I'm a forever learner. That was instilled in me. So I guess I kind of just accidentally fell into dentistry. And it was appealing to me because I did have that marketing business background. I did have this independent spirit that I didn't realize was called entrepreneurship. At the time, I was like, wow, this could be a field that I can be good at. I'm crafty, I'm creative, and I have the opportunity to own my own business. Unlike other aspects of medicine during that time in like the early 2000s, where a lot of private practices were shutting down, and you see that now and getting bought out by corporations, where you have to join big groups. And we're seeing that trend now, unfortunately, or not unfortunately, but kind of unfortunately, in dentistry. And you probably see the same in chiropractic care as well. So I think the stars aligned. And then I got to dental school, and it was a blast because I was older and I got to relive my school days again.
Hmm.
Um, but what I realized was I was good at it.
Yeah, and I'm glad you are because you've been named Best Dentist and Kindest Dentist by Posh 7
Yes.
magazine
Yeah.
in 3 consecutive years. So what do you feel like, first of all, how do you feel like that recognition has shaped your practice, and what do you feel like sets you apart from other dentists?
Yeah. Um, Let me think about that. So when I first started out, and still, always want to be the best. Like, no one hates that type of recognition. And it was like a
Yeah.
goal of mine, right? I want to be recognized. I want to be known by, I want my name in shining lights. Or again, I was also a thespian, so I was really into theater. So
You-
I loved it. And it was such a driving force. And, early on, it was a goal because you wanted to grow it. Um, and I'm not saying I don't want to have that type of recognition. I always strive for that, but I realize what matters most is the recognition you have from your patients and your peers. Because we also know a lot of those things can sometimes just come down to marketing dollars and that type of thing. So what it has helped me realize is that I do want to be a leader in the community, um, to like in Loudon, right? To our community of people. But I also want to be a leader in dentistry in general, in the industry, to my peers, to elevate um, the quality of care that patients receive, because patients deserve better than sometimes what a lot of our providers, dentists, are able to provide when we're confounded by certain structures, right? And I'm not going to be around the bush. I am talking about dental insurance. So when we start out and we're in that type of environment where we have contracts with dental insurance companies, what a lot of patients don't realize, people, myself too, I didn't understand it. I have a better understanding of it now for even medical, that when you have a relationship as a medical provider with a dental practice and you're considered a network, what you're saying to that company is, I have value, I provide services, I am unique, I am the best, but I'm going to allow you to set the fees and set that value for me. And unfortunately, in dentistry, there are many, not all, plans and companies that haven't revisited or increased or changed their reimbursement rates. So meaning what we are allowed to bill out to patients, since it started in the 70s. So since like 1975, a certain dental insurance company, I'm going to keep them nameless because, like, I don't know, they're big companies that kind of scare me. They literally haven't changed their rules since 1975. And it's impossible. And that's where you get patients who are frustrated. They come in and day out. I hear it. I'm frustrated because I've always had cavities. I'm always having gum problems. My tooth keeps breaking, and they just keep treating one tooth at a time. And this type of dentistry that is kind of involved or intertwined with this dental insurance, it prevents caregivers from treating you like a whole human being, a whole mouth, a whole system. You treat teeth, not people. I know I got off a little bit, but I'm going to bring it back. As I started in this realm, what I realized that that's not the type of dentistry I want to provide. It's not the type of dentistry that patients deserve. Patients deserve the time from their providers to listen to their histories, to listen to their concerns, their anxieties, their past experiences, and for the opportunity to possibly tie in other health issues, other, um, whole body things. Keith, I work with you quite a bit with my TMJ patients, right? And we talk about alignment. That takes time to think about.
Yeah.
That takes really a lot of time and thoughtfulness and the intention of a dentist or medical provider to seek out that type of training and skills and knowledge. Um, and in order to really bring all that together and provide exceptional patient care, you have to take big steps and be intentional in the relationships you make with these third parties. I think I jumped around there a lot, but
That's okay.
it's important to me.
Absolutely. So basically, what you're saying is you're not allowing the constraints of insurance companies to allow you to just treat patients in a very linear fashion. Like, perfect example with TMJ, you're able to really examine the whole patient, the jaw, the teeth, possibly use a referral partner to help treat that patient. Versus if you were constrained by the insurance companies, you may not have that luxury of doing that, or how would you be limited in that way?
Exactly. Well, a lot of plans don't cover TMJ care. So when you have a lot of patients who are only who are very focused on that, because that's how we've been trained, conditioned. I like to say that's how we've all been conditioned to exist with our bodies and the care that we seek out is say, okay, well, if it's not covered by insurance, I can't do it. So it's constraining in just the it is preconceptions that patients already come in with. So if it's not covered, it's not important, it's not real. It also, even if the diagnostics, even if the treatment isn't even out of the realm of being affordable, even if it's affordable, patients already sometimes have this preconceived notion, well, it's not covered, I'm not going to do it. Um, they make it difficult in other ways too, saying, okay, they have limitations on things. So, say they have a certain oral appliance that I think they need to utilize to deprogram the muscles of their jaws and their joints. Some plans will say, okay, we'll cover it, and then they'll turn around and deny it because of XYZ,
Got
right?
it.
So they make it complicated. They waste incredible amounts of manpower in the office setting. In any dental office, there is someone in the back room on the phone all day long arguing with, honestly, probably a robot that's either denying or sending claims through. Um, and patients, they're left confused.
Yeah.
They're left unsure of who to trust. So to just combat that, regardless if you have insurance or not, I'm going to treat you the same way for a long time. Like that means I spend an hour with new patients, 45 minutes to 60 minutes with every single new patient, getting to understand what's important to them, really helping them see what I see, utilizing different technologies. I have a tooth scanner or bite scanner that we can show patients in a three-dimensional manner. I've got specialized devices that listen to the joints so I could determine whether or not, you have a slipped disc, or if it's just a muscle issue, or if there's just more inflammation on one joint than the other that's causing um, disharmony between your bites and how you function, that's leading to headaches, that leads to cracked teeth, things of that nature. So I utilize all these things regardless, but you know, I have been able to move in a different direction where I am really being mindful about the contracts that I sign up with. But I have a lot of patience, and you practice in this way solely is, who realize the value and come in, regardless of what their plans cover.
Absolutely. And I'm glad you brought up the, different specialties that you do and the different technologies that you have, because as we all know, businesses are rapidly evolving, right? So
Mhm.
how, do you, um, I guess in your field, how do you keep up to date with the latest advancements? What do you do? How do you keep your staff updated? How do you
Yeah,
really just try to provide that top-notch care that, you feel is so valuable to your clients?
yeah. First and foremost, I surround myself with like-minded dentists. So when you are at the table with people who are always reaching for better ways to care for their patients, to better perfect our own hand skills and our better ways of communicating to patients, I'm driven to excel, right? I'm competitive in nature, so I want to be above there. I want to be amongst the best. You mentioned in my bio that I am involved with, clinical mastery series. That is a program that I started as a student, and just felt right away that this is a community for me. So it's finding the people who are like-minded, who believe in, providing higher levels, right? Through that, I am, I would say I am respected by other people, like different companies in the industry, and they seek me out and they ask me to be involved with the technology as well, right? So, for instance, locally, I'm involved with Invisalign, and they are the manufacturers, or they run the iTero 3D scanner. You've seen it, and so I've been able to be on panels to speak about that and how to implement it. I take the time, with my team. In October, I'm flying my entire team out to Dallas for hands-on training. We're business owners here, right? So as a business owner, you have to invest in your team. You have to invest in your team, and you have to trust that they have your best interests in mind. And you also have to look out. If you realize you have someone that is passionate but they're not picking up, that's the hard part of that's the hard part of business ownership too, is knowing when someone isn't quite up to the challenge that you need them to come up for. So that's just kind of a segue into that. But it's being involved, being surrounded by like-minded people, and absolutely investing in your team and raising
Yeah,
them up, and also taking a chance on taking someone who might not be as experienced, but if they show passion and interest and excitement in what it is you do, you hire them, and you raise them up, and you bring them up, and you get them excited, and you teach them how to do it. Like,
yeah,
you just can't expect people to come in that you hire and them to do the things you want to do the way you want them to do it, unless you help them, and that's hard to do if you don't know yourself.
absolutely. I'm so glad you brought that up. My mom, just a side note, just brought that up to me the other day because we, for years have been flying our staff to different conferences and, sales conference, marketing, because you're absolutely right. You have to invest in your team. You're so much more influential when your team can affect others, and then it's not just about, the doctor or the owner of the business. It's about your team. And so I was explaining to my mom, she even said to me, well, what if, you fly them out to Sarasota, Florida, and they quit? And I'm like, well, mom, then, that's okay. They still got the experience. They still benefited from the training.
Hmm.
Even if I said, this training will benefit them whether they go on to be a dentist or a chiropractor or whatever they do, sales,
Right.
business, it is ingrained in every aspect of our lives. I'm like, and if they
Hmm.
quit, I said, Mom, great. They can always say, hey, I went to a great training with, Dr. Brassfield or Dr. Claustro, and I learned
Yeah.
a lot, and I can use it at my next job or my future job,
Yeah.
or who knows, maybe one day they'll open their own business and they'll
Right.
come back and thank us. And I think that I'm so glad you value, your teams, and that is such an important part of, entrepreneurship and owning a business. What are some of the misconceptions you feel like people have about dentistry? Or you brought up TMJ, management, you know, um, what are some of the common things you hear from patients, and, how can you maybe help them better understand those types of areas?
Oh my gosh. I feel like there can be subgroups for each one, right? Um, I guess like the very first, like the most basic thing is one misconception is like we're just here to like clean your teeth and
Yeah,
that's it.
yeah,
That's not true. As dentists, your mouth, your smile, this is kind of canned because you hear other dentists say this, but it's true. It's the gateway to your entire body, but it's also like the the door to like all of your social interactions, like confidence, your the way you experience the world through speech and facial expression and eating and food, and it's so great, right? So it nourishes both your body and soul. So that's my first thing. Like, we're really, really important, right?
yeah,
We're really, really valuable. What our dental hygienists do is incredibly, incredibly important for heart health, for helping you control your diabetes. What us dentists and orthodontists do is so important for managing headaches and pain and alignment and like cervical comfort and back comfort. Like, people don't realize like what a cornerstone our mouths do. Our teeth provide a shape. If you've seen someone who has unfortunately lost all their teeth for whatever reason and they're not don't have their dentures, and you just see their faces get squashed, right? Um, People who like, the more likely you are to lose teeth, the less likely you are to have a long life. Like, there
yeah.
are true correlations behind that. Um,
Go in
so
more, go
we're
in more
important.
depth. Sorry, I'm gonna cut you off.
No,
I
yeah.
apologize. I love how you said diabetes. Like, just expand on that. Like, how does a dentist, or certain things you see, how does that correlate to things like diabetes? Or you also said heart health. Just,
Yes. So the bacteria that is associated with periodontal disease, right? So you've got healthy gums and teeth, you've got gingivitis, which is the inflammation, and then you've got periodontal disease, which is where you have massive amounts of inflammation in your gum tissue and you start losing bone. And then the flora, so, all our mouth have healthy bacteria and whatnot, but the flora changes so that it starts converting to red bacteria, like bad bacteria, and they live in the deep pockets between your teeth and the bone and the gums. When that happens, your immune system kicks in to hyperdrive, and that's where you start having issues. um, the inflammation itself is what likely is the actually, it's not likely, it has been proven, is what leads to heart issues. So the inflammatory cells, I'm not going to tell you what they're called because I learned them once and I have forgotten. I can find books and
I
you can
think,
read all about it.
right.
They can lead to greater fragility of your cardiac system. So your arteries become more fragile, and that could lead to heart disease and heart issues. There is a strong relationship between HbA1c levels and how well controlled your periodontal diseases are, and that's related to the bacteria. And again, inflammation, right? Inflammation, it's going to kill us all. So
Sure, got
that might be a little dramatic. Maybe cut that out. But
it.
inflammation is bad. And again, when it's in your mouth, that's so vascular. And again, it's that gateway. Um, there are evidence now that the bacteria that's associated with your mouth can be related to certain cancers. It can be related to certain, cognitive issues. So there's just so much that you can see. And even from a diagnostic standpoint, and this is something that I've been becoming more interested in just for my own overall health as I, you know, have surpassed 40. I know it is unbelievable. I look fantastic. Not a day over 21. But these things are becoming more important to me, Keith,
Yeah,
right?
yeah,
Like, I want to know, like, am I vitamin deficient? Do I have like thyroid issues? Those are things that we can see as dentists if we know to look out for them. If we have raised up, elevate our own education and knowledge to look out for these things for our patients. But yeah, I mean, I
yeah,
can keep going on. Do you want to know
yeah.
other more
Well,
misconceptions?
well, I think more like I'm interested in, and maybe our viewers would be interested in more of like more of the, you know, cutting edge procedures that you're doing. Like,
Yeah.
what do you think like the advancements in dental care specifically, since you're the expert, like what are some of the things you're seeing maybe, in the near future or that may have an impact on overall, patient health and wellness? Like what are the things coming down the road? Or since you do a lot of training, you invest in your team a lot and you're
Yeah.
a part of these clinical mastery series, what are you seeing coming down the road that, might be able to help us as patients, that dentists specifically can focus on?
I think digital dentistry and AI are they're here. It's not just
Yeah,
coming. I'm actually
yeah,
really excited to start implementing some digital AI because humans can only see so many shades of gray. So when we have our digital x-rays, we kind of see what we see. And it's true, there'll be some days where I'll have a patient come in. I'm admitting this. With my bare eyes, I'll see something on an x ray, right? Some things, I'll bring them in, and then they'll come in, and I'm in a different room with different lighting, or I don't know, my eyes are just more awake that day. And I'll realize that it's even bigger than I thought it was.
yeah,
So with AI, it will see all those shades of grays that represents densities that we as human beings just can't. So that's really exciting. Combine that with things like the scans that you have seen in action in my office. We're able to educate patients on what is happening, what we see. So, for instance, I have patients always come in and they say, my doctor told me that my previous dentist told me I grind my teeth, but I don't believe them. I don't see it. Now we can actually show them. We can
hmm
show them the evidence that is visible on their teeth and in their gums and in their bone, and they can see it. And it helps us have better conversations with them. And for me, when I do the bigger cases, so I'm a functional rehabilitative dentist, right? So I do a lot of full mouth cases where I basically bring people who have destroyed their teeth and make them functional again. Um, it's not something that any dentist can do because you really have to understand how the joints work in harmony with the muscles, work in harmony with the teeth. And then I bring it further, work in harmony with the alignment of your body. And also all of that with lifestyle. So those are things where I'm able to do that type of dentistry thanks to the technology. Now, what's really exciting is that they're having more and more innovations in 3D printing in dentistry, right? So I have a 3D printer. I am doing the most basic things with it, but there's amazing things that I'm learning. There are programs called exocad where I can literally bring in like patients design their new bite, design their new smile, help them see it in real time so they can understand what it means to replace the enamel that they've broken down over time. Or if it's someone who is aesthetically motivated, they can see, or I can even print out like a sample of their new smile so they can feel that joy that dentistry can bring them. So it's really allowing patients to have a little bit of buy-in, or not buy-in, see the end result. I can help people see the thought process and the intention and the blueprint before they even invest in it. And that's very powerful for any healthcare provider because it kind of like takes it from being a concept to something that's real for a patient. And with 3D printing on the rise, our hope is that the materials can get so strong that these are things that we can now design and print in-house, and that's going to make high quality dentistry even more affordable for patients because
And
that's what we want.
do you think the idea with 3D printing is like you can I don't know, like dentures, like so if you're recreating that functional structure of their bite and say their
Hmm.
teeth are all worn down, do you think in the future we'll be able to 3D print, people like new teeth? Is that
Yeah.
something that could possibly happen with that?
Yeah, I mean, I'm already 3D printing dentures, so which is amazing. I have
Yeah.
patients who they no longer do you have to wait, weeks for what we call an immediate denture. So unfortunately, you're losing, the remainder of your dentition on the either upper or the lower. We take scans. I send it to a designer at this point, but my hope is so I can start designing it in-house myself again to bring that cost down for my patients. But it's not out of, crazy. And that designer can have it back to me the next day and I can print something out. What's awesome is we at my practice take these wellness scans. So we already have a baseline for each of our patients. What I want to start doing, I'm thinking out loud because this is what us business owners need to do is admit when we're missing an opportunity to serve our patients better. And what I realize I don't do is I've seen some of my colleagues who are doing this, they already take some photos too of the full face at their first appointment. So when this happens, if someone's out playing hockey and they get a tooth knocked out and it's devastating. I mean, it is. I said that again, but like it is. It's scary. It's devastating. They have a big business meeting. They can call me up. I can print out what we call a flipper, and boom, it's based on their scan and the smile photos that we already have. So having all of this technology at our disposal just makes us care for even what's possible an even greater like experience for our patients.
I love that. That's awesome. That's exciting. Now I'm going to
It
be
is.
selfish here because what about gums? Is there any advances in the technology? Because I know, when I brush my teeth too hard, my gums
Yeah.
recede. Like, so for receding
Yes.
gums, do you think there'll be technology that's going to help our be able to help maybe like receding gums or that type of tissue, or is that not
Yeah.
possible
You
yet?
know, well, there is, and I guess it really depends on the type of recession and the extent of recession of your gums, and also the reasons for recession. Um, I'm not going to talk to you about your specifics because I know what they are and HIPAA, but a lot of times the recession is if you can get rid. So let me fast backwards here. So
Yeah.
when you have recession, it's because you're losing bone. So if it's recession because of periodontal disease that we kind of spoke about, then the bone's already gone. So the treatment is putting grafting, and that's been around for years and years and years. Um, I have instances where my patient's recession is because of how their bite comes together. So there's disease of the teeth, disease of the gums, and disease of the bite. And your disease of bite can lead to diseases of the or instabilities of the teeth of the bone and gums. So I have had patients where we correct the bite and their gum tissues improve. There's less bleeding and recession. Or they get the grafting done and that grafting takes a lot more. Or I have a patient who has worn down their teeth so much and that pressure has led to the recession. So when we rebuild an entire arch to be full again, like the original shape, as nature has it intended to work functionally together, you'll see improvement in the recession, the gum health, or the longevity of a graft if that's what is done. So the technology is out there. This is making me realize, Keith, Dr. Brassfield, that you need to come in and we need a bigger conversation.
Yeah, I mean, we can go, well, another thing, because I know TMJ is one of your specialties too, and you
Yeah.
mentioned it before, and I feel like that's something that I see a lot too, and that's, just for our viewers, that's probably how you and I have such a good relationship because we do help each other in that area. Um, Talking about like people's, you were mentioning, how your mouth is the gateway to your health, but then also your face and things like that. So with TMJ specifically, since that's very common as well, and I'm sure
Hmm.
people, see that a lot. Yeah, how do you go about treating that? And I know that's a difficult one. For me myself, that's why I refer a lot of patients, to their dental provider, depending on, their bite. I'm looking at it from more a structural thing with their cervical spine and their TMJ joint, but I know you address it a little bit differently. So how is that
Yes.
something that, are there any latest advancements on that type of treatment, or how do you kind of go about that?
Well, the way that I go about it is really looking at, is it truly a disorder of the joint? Is it muscular? And then once I kind of get an idea of that, you ask why. Is it because of an injury? So I have severe, so for instance, for me, like I have two displaced discs. So there's a disc that protects the bone that sits in your skull. Mine no longer sit in its place. So I can't open my jaw wide enough. Like I can't. So that's an injury. I don't remember the injury, but it happened. Um, then there's people who have muscular issues. And then that leads to the headaches. That's when you get migraines. That's when you kind of get irregularities. The SCMs are kind of differently triggered. You'd have trigger point pain. So you kind of treat the symptoms, which, I've sent patients to you for the symptoms, help get their cervical alignment in better shape so we can better treat it, so I can better identify the source. With those type of things, when it's a little bit more muscular and the joint is healthy or healthier-ish, um, and I use my special listening device, my JVA. It detects the vibrations in the joint, to kind of help me determine the health of the joint or the condition, the status of that.
Hmm.
A lot of times you realize it's because the teeth are now hit in a different way. So you might have one, when you're closing, one tooth hits just first, just a teensy bit, like a little bit,
Yeah.
and that could throw your whole body off. So those are just things where yeah, you gotta see your dentist. And then, depending on, the patient, sometimes you just say, okay, like, how much does it bother you, right? You warn them if you're hitting a tooth too much, you can crack a tooth and end up needing implants. You really listen to like what the patient's tolerance for that pain is too. If it's something easy, then we say, okay, like chiropractic care, palliative care too. Like maybe get you in a night guard, eat softer foods until the pain goes away and then it goes away. Or do I need to really take bigger diagnostic steps to see and understand how your teeth come together so I can determine the order in which your teeth come together. And then I go in and like adjust every tooth so that you have an even, like, smooth functionality when your joints are in a healthy position. And then there's moving teeth with orthodontics. So there's that. And then you throw in things like laser therapy to get acute pain out, which is what I use. I use the soft laser, an MLS laser. I also utilize a lot of Botox. I use Botox on myself, especially when patients are really at that point where they're like, is it surgery? Or do I just manage this pain? Or they refuse to wear their night guards because they can't tolerate it. Um, and another thing in relation to, I know you're aware of this, but our TMJ health, our clenching and grinding, greatly impacted by airway. So that's a whole other aspect that many of my colleagues are so involved with. I know it just enough to know when to refer that, and to help patients understand that. I personally don't treat airway in my practice. I screen for it, I educate on it, but it's not in my practice yet, but maybe in the future.
I'm glad you brought up Botox because I know a lot of, dentists are bringing that into their practice. Um, other than TMJ, like what are some other things you might use Botox for with a patient, and how has that kind of affected your business model?
Yes. Headaches in general, here, the tension headaches, which also helps beautify. I don't use it, by the way. I'm just lucky.
Of course. Of course.
That's so funny.
You're
But I don't
naturally
judge
21
that.
all the
Don't judge
time.
that. But I also use it to treat gummy smiles. Botox for treating gummy smiles. I use filler also in my practice. Patients who have oftentimes have like chronic like issues here, like chapped corners of their lips, kind of like thrush that happens there. You
Mhm.
could use filler to help patients rebuild the structure so that there aren't like dead spaces or like spaces where like that saliva can connect there. I have tried a couple of times with mixed success. I'll admit, you can use filler to like fill in gum gum spots where some people might have different levels of that. So those are fun things like that. So,
Yeah.
but Botox, in Virginia, we are slowly being able to do Botox strictly for aesthetics. So I'm not going to say that I do that at my practice.
Okay. Got it.
Yeah.
All right. Well, you're obviously an expert in the dentistry field. I'd like to kind of transition to a little bit more community because I know you're a
Yes.
huge person in the community and with your
Yes.
background in
Yeah.
marketing and all those types of things, how do these affiliations that you've connected with just broaden your community and, um, support your other professionals in your community?
Well, I think, well, first and foremost, like when it comes to marketing, right? I think my approach to marketing isn't traditional for some other health practices, dental practices. I do my best to keep everything in house so it's a true reflection of me.
Mm,
Because I think sometimes what happens is we as healthcare providers or maybe any other professional, like maybe it's not just us doctors,
mm,
but I think for me, it's important for people to understand that I'm a community member too.
yeah.
So I love building relationships with my patients. I love supporting their teams. I love supporting even beyond that. Like, I think that's very, like, that's what we all do. But I truly support patients in their lives too. Like, it's amazing how many patients who are going through the same thing with me in life and we meet up for coffee or drinks, patients who are, you know, trying to get their own businesses up and running, and those are the people that I really choose to focus my energy in supporting because they support me and I support them. And if it then it also trickles out beyond that, they have another person that they know that's really close to them, and I then that's how I choose that my network a lot more, just because then it feels natural because it is natural.
Yeah.
So like it's really a much more organic way of building my network, um and not feeling like I have to do every single like networking event and do every single community group and do everything that because that's also hard on a business owner, right? It's very taxing. When I was doing that when I started, there was also like you get a little bit more of that imposter syndrome. You are unsure if you're doing the right thing. So when you kind of organically grow your network and meet people through here or there, or meet people when you are having dinner or you're at, the bar and you're talking to someone, like that's how I really like to interact and select what I do next, right? As far as community building. Um, and I think that has helped me. Online, the same is true, right? There's so many different forums out there that I'm involved with. I like to choose the ones that are on brand, that are kinder, that are supportive, that raise people up, um, so that I also attract the patients who I know will value the type of care that I provide. Sometimes I feel like if you do really mass wide reaching, overreaching marketing programs, you get a lot of people,
Yeah.
right? That's when you say, okay, we've got the quantity,
Right.
but quality goes both ways. When you're building a practice where you really put your heart and soul into it, you really want to attract patients, clients, customers that value that. You don't want someone that's looking for a freebie, because you're worth more than a freebie, right? And that's going to be true whether you're a plumber, a nail salon person. Sorry, I don't know what you're called. You have a restaurant,
Is it a
a
nail?
nail tech. Okay, in all fairness, I had not gotten my nails done in maybe 15 years. So let's be fair. And I finally did, and now it's my thing. So it my nails
So your nail
give me
lady, your nail
life.
lady, your nail
My
salon
nail
person.
lady, um, a vet, like, you don't, I feel like that goes back to setting that intention, right? You need to set intention with the outreach you do. And because you're not doing outreach for just for outreach, you're taking time away from your own
Yeah,
family when you're doing it. So you might as well do things that really feel right for you, whether it's a cause, whether it's just the vibes, or whatever it might be, right? Like, I supported Rockridge High School's music program, or their theater program this year. They did Rent, which is the best gosh darn show ever, and I loved it, and I was so excited. And they came to, like, one of my patients is highly involved, which I found out afterwards, and many of my patients are, is, that's how I kind of choose how to do it,
right,
whether it be right or wrong. I'm inspired a lot by you, though, because I see you going out there and doing incredibly kind things, and which is why I hang out with you a lot, because you reflect that type of value that I appreciate, and that is the type of business and community leader that I want to support. Another thought process that goes along with your question, I think, is as being an industry leader and, like, faculty member, influencer, if you will.
yes,
um, I don't shy away from meeting with other dentists in this area and helping them try to do what I do, right? Whether it is doing the full mouth rehabs, right? Like, we have a mutual friend and colleague, Dr. Jenny Bobbio, who's incredible. And I just love seeing her success so much. And I've helped her get into these different educational programs. And she's just one person to think of. Just because we both know her, I thought I would bring her up.
but back on that note, just for our viewers, so I think this is a great point to bring up because you mentioned it earlier, how you like to help, new business owners, and that's
Hmm.
exactly so for all of our viewers, that's how Joanna and I met. Joanna uh, came to my practice off a referral from a patient, and
No, actually,
then
it's because I saw you on Instagram.
oh, Instagram, good. So I'm glad the Instagram posts are working.
And then a
Yes,
patient,
yes,
and then a mutual patient mentioned you. So I saw
and
you, and then
mhm.
it connected the dots.
And that is Marketing 101, taught by Joanna Claustro. Yes. And then, so then Joanna started coming to my office. Then Joanna started helping me, just like she preached a couple minutes ago about how she likes to help, because I was a brand new business owner. I think I was only in practice for less than a year or
I
something.
know. I was like, I don't know if he knows how to use this machine he's got. Just kidding.
Yeah, exactly. And so I'm sitting, we even have a picture of Joanna Claustro on our therapy table as I'm doing TMJ work on her jaw with her son on her chest on an iPad, which is the
Yeah.
best picture ever. It's like,
We need to revive that. We need to make
yeah,
t-shirts.
we should make t-shirts. And back to my story, look, fast forward. So Joanna helped me when I was just a very young business owner, had no idea what I was doing. And you did preach, build relationships, build community. Fast forward a few years, you, I believe, referred another Dr.
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 Bobbio.
Bobbio. And then I found myself doing the exact same thing with Dr. Bobbio because I learned that you did it to me and then I wanted to pay it forward. And so I was paying it forward to Dr. Bobbio. Fast forward another year, now Dr. Bobbio's got a thriving practice. And I
Hmm.
bet you Dr. Bobbio is going to do the same thing to another person. So
Yeah.
the pay it forward motto that you have started, Joanna, look at the ripple effect you've just had. You've helped
Oh
me,
my gosh,
and
ripples.
me be a successful business owner, and
Oh
then
gosh.
I in turn have now helped Dr. Bobbio. I'm not going to cry because I'm about to cry. And
Yeah,
now look at Dr. Bobbio is crushing it. She's
crushing it.
literally like booked out 3 weeks. You
Yeah,
know, she can't
yeah.
even, she's hiring, she can't even hire enough people
I
to
know.
handle all
I
the
know.
clients she's seeing. And it's all
My
because
chit
of,
chat with her is all about the insurance stuff. So,
well, we already went over that. Okay. But the whole point of it is I want, you know, new business owners or people, and that kind of goes into my next question, Joanna, of, it sounds like you've done a phenomenal job building your practice and you've talked about the marketing. What would you recommend to a brand new dentist right out of school, if they were going into practice or even as somebody who wants to open, their own business. You've obviously done it your way, being more authentic, being more
hmm
organic with your,
hmm hmm
relationship building. Would you
yeah.
have the same advice for somebody else coming out of school that wants to open their own dental practice?
I think, yeah, absolutely. And I think a lot of that has to do with really understanding who you are and like what your true why is, right? And like I had that same why and my same goal, like, or I had a why and a goal when I first purchased my practice and understand that it will change and give yourself permission for that goal and that standard for yourself to be dynamic. But like when you're building it out, um, know what kind of impact you want your business to have on the community, but also with your family. Because I think that is something that I might not have like quite figured out because when I started, I didn't have a kid. It was not necessarily in my plan, but I decided that, and now we are, and it's amazing. But what I think the point is, if you don't have a purpose, you're going to get burnt out. You're not going to be happy with anything, and you're going to be pushing for a number, like a monetary number, and sometimes that monetary number has to do with the number that like you're like, I guess, like what you sell, right? But not necessarily even what it might not even reflect what you need to take home to support your life and whatever that like my life might be. And when you start out, it's just basic living, right? And then it goes further, just think about your lifestyle. So I think that's really important when you start out a business, because small businesses will take over your life. It can.
That's the
Write this
understatement of the
down.
year.
Take a piece of paper and write this down. It will take over your life in good ways and in really bad ways. I will be first to admit that like therapy has helped me, couples counseling has helped me, like getting coaches to has helped me, finding other women specifically to understand and who are willing to speak out honestly about that. Because whether you are super successful, like I believe I am, or just starting out, it can really throw your personal life off kilter real fast. And if you are a person pleaser like myself and probably anyone in medicine, because why would you do it otherwise? Is you'll put everybody else first. You'll put your patients first. You should put your patients and team first, right? Like that's what we believe in. And then you'll put your family first and your husband first or your wife first or your parents first and your dog first and then your kids friends dog first, and then you don't realize you haven't left room for yourself, and like you no longer enjoy what you do. But that's like really big deep stuff, but it is honestly, I wish someone had prepared me for that more. And like I would say every year, take stock of that. Is your original goal really what you want to be working towards? For me, I wanted to have multiple practices. I wanted to be huge. I wanted my name on the wall. I wanted everyone to know who I was. And then I think it switched after becoming a mom and after COVID. I realized that's not necessarily what I want. And in our industry right now, the way that it is, I'm working extra hard to make insurance companies rich, to make other companies rich. We are in business, so I'm not going to shy away from wealth because why, why are we want it? And like anybody else, just like anybody else who gets paid by a Deloitte or a Walmart or the Giant, that we have lives and goals and vacations to go on, right? So there's nothing wrong with that. But if you don't also define, okay, what's that limit, right? I can keep going, that I can do that and make X amount more, less more, but you're not home. You got ulcer, your hair's falling out, you've got brain fog. So be okay to adjust that, because you might also find once you adjust that as you continue to build your business to be more in line with what you need personally, because when you first start out, it's business. Like you gotta understand, like your personal life, it comes second while you build it. But then once you are at a place where you could sustain it, don't keep doing that unless that's really what makes you happy. It is okay to say, I'm going to be smaller. I'm going to care for a smaller population of people who value a higher quality product, right? I'm going to talk in terms now for your general audience. Like they, that is, if that's who you want to be that person, because you won't need to spend as much time at the office or catering to every single person out there. We don't have to be the best XYZ for everybody. Um, and you will be richer because you will be happier, and more than likely, like you're not going to see a dip in what you bring home depending on what services you provide. So that is, I think, something that I have learned over the years, um, and have definitely spoken about with other people. And I think it's especially true for, that's not true. I was gonna say it's especially true for women, but I think we can't own that. I think burnout is for everyone and
Yeah.
we all experience it differently and it looks differently for everybody. So I think
That's
that's the one thing.
I think it's so interesting we're doing this podcast today because I literally just had an interview this morning with an associate, and the young gentleman was in his 20s. That's exactly what he said. He started a practice, he had a coaching company. He seemed to be doing well from what he said. He started it 3 years ago, and he said, um, it was a high volume practice, so he had
Mm.
the stress of just always having to get more clients in the door, more clients in the door.
Mhm.
And even with his mentorship and with his coaching that he had, he was just like, I
Mhm.
was just mentally strained. He's like, I couldn't turn it off. And that's why he was interviewing with me, because he still has his practice
Mhm.
and he's kind of transitioned a little bit. He's offering different services now, but he's like, I just want to be an associate. I don't want to have to, you know, I want to be able to turn it off. And I feel
Yeah.
like that, I mean, I know I've suffered from it.
Oh,
I told three patients today. They're like, "Hey, how you doing, doc?" I'm like, "I'm ready for a vacation." They're like, "Oh,
yeah.
really?" I'm like, "Yeah, because
And you
I
need to
have,
take that
yeah,
vacation.
I've been working my butt off, and we're normal people too. I mean,
Yeah.
people think that we have these complexes because we're doctors, but it's like we need our vacations too. That segues into my next question because I'm so jealous that Dr. Claustro takes these amazing vacations. And since we addressed business, we addressed your practice, but
Hmm.
now I'd love to learn, how do you juggle, because you do have a successful practice, you've got a phenomenal team, so I know that has a play in it. How do you juggle your personal life, being a busy mom,
Hmm.
having these amazing vacations that I know you and your husband go on, while also maintaining a successful practice?
The number one thing that's allowed me to even consider doing this is having a team that I trust, right? And having a team that I know I can, kind of leave and know that things are at least being taken care of. I can't always have the practice running all the time, but like I know that there are people with my best interest and who are capable of at least answering questions while I'm away, right? And this is true for like my team has evolved over the years. So it's not even just the same person. I'm very fortunate to have a team member that's been with me for over 9 years, going on 10 years, Julie. she'll watch this, so I want to make sure you don't cut that out.
Shout out to Julie
Shout out to Julie.
or
Um,
anyone that stays with their employer for more than 10 years.
years. But I have new team members who I honestly feel just as appreciative of, right? Because they come on, they learn new things. Um, the next ingredient to going on vacations as much as I do is being willing to take the time off, giving your permission to step away from your business. And you are going to feel that like you're going to come back, the business is going to fail, you're going to go into foreclosure, you're going to come back, everything's flooded, or suddenly there's a circus running in your in your ops. Like every single little thing can go through and things go wrong. Like, Murphy's law, that's when someone who's been in a rehab temps, that's when the temps fall out and you're like, oh crap, Dr. Bobby, how can you see my patient, right? But it's giving her permission to do that and like not letting that narrative of fear of leaving do that. I have a patient of mine, I will not mention his name because he's a patient, but he also has a successful business that's been around for 13, 15 years, and he has just now taken his very first vacation. But he did it right. He took like 2 or 3 weeks off, and it really, that that pains me. I was the same way, like the first 2 or 3 years. And then I think one thing that kind of helped me realize it was when I took my maternity leave, right? Um, the third, the third part of going as many vacations as I do, and this is important for business owners and just people who spend money because you have to, is using the right credit cards and maximizing credit card points. I
Alert
am going
everyone,
to
this is Joanna's side business. She's going to start a business on how to get the most credit card points possible,
I
and then you can let
just
everyone else know how to do it.
just let everyone else know. And I'm putting it out there. Like, it is literally a side hustle that's in its infancy stages. I'm gonna plug it here because I can.
Hmm.
Um, it's gonna be We Work to Wander. It's because that's what we do. We work to wander, right? And I don't know what it's going to be yet. I would love just to talk to people like this. I am on TikTok under that, so you can already follow me there. On Instagram, it's We Work to Wander Family because someone already owns We Work to Wander. And then on YouTube, which I have a few videos, and I invite you to watch it and laugh at me.
Oh,
So
love
there's
it. Love
that.
it. So if you are looking to maximize your credit card points in the most efficient way possible, you have to check out To Work to Wander. Work, work,
We work to wander.
we work to
We
wander.
work to wander.
We work to wander, or we
So let's
work
be
to
real.
wander family.
It's really just me that works to wander.
Yeah,
Bob
Bob's
works,
lazy.
but he's
Bob's
like,
on his dirt bike every weekend. He
yeah,
doesn't
right.
work at all.
He's
Jeez.
he's employed, government contractor, clicking
Mm.
in doesn't need to talk to people or have stress.
So, in all seriousness, back to what you mentioned about taking vacations. What do you think it is
Yes.
about business owners, entrepreneurs, maybe doctors? Why do we have such a hard time? Because that is so common, right? Like, especially
Yeah.
in the first few years, I think, like you said, it is very fear-based, right? It's like, oh, I don't want my business to fail. But even like you said, your friend had been in business for 15 years, and he finally decided, like,
Yeah.
what is it about our DNA or entrepreneurs or business owners that you think prevents us like from just enjoying our wins or taking the time to enjoy the fruits of our labor?
The fruits of our labor. I think it's multifold. I think you nailed it on the head. Like, we care too much.
Yeah.
We care too much. Like, we truly, even on vacation, we are thinking about our patients. I think this last time when we went to Iceland, flex, for 10 days, and I can't prevent, like, I think it's really truly the first time I really allowed myself to not connect myself to the practice as much as I usually do, right? So we have the fear part. Then there's kind of like this guilt part.
Mm,
Um, and I can speak for myself. There's also that part where you are a doctor, you are a business owner, you don't want to necessarily display the fruits of the labor,
Mm,
right? It's kind of like it took me a long time to like say I deserve a car that's nicer than my CRV because I don't want people to think there's this, right? A misconception, bringing it back a little bit, is like, you want me to do this dental work because you want me to pay for your boat. And it's like, no, like I honestly want you to do this because it's good for you. Please get that out of your head because that's only harming you. But also, yeah, I would have a
yeah,
boat. So
yeah,
the same thing is true here, is like, I feel like for me, it was like, I don't want to go on vacations. I don't want my team to think that I'm not in it, blah, blah, blah. But what you have to realize, that those are narratives that we tell ourselves. We
yeah,
deserve it. Our teams deserve it too. Our teams deserve vacation time. They deserve to get away also. I am oftentimes like enraged when, I see other professionals on different forums be like, oh my gosh, I can't believe my, assistant wants to go on vacation like in 2 weeks. And you're like, it is annoying. I roll my eyes sometimes when you're like, you could have told me like 4 weeks ago, but they deserve it. You
yeah.
deserve it. If it's chronic all the time, that's one thing. But I think it is a combination of just, we're gunners, we put everyone ahead of us. It's We're the last to deserve it. We're the
Yeah.
last to deserve it, and we are the last that we give permission to go. But once you start
Hmm.
and going, and it's like beyond just the long weekend, right? Once you realize you can take like 10 days off and nothing explodes,
Yeah.
like, I think that's excited. I'm excited to get to the point where I can take 2 weeks off, but mostly so I can go to farther areas like the Philippines, so I can share my parents' culture with myself and my son, right? And also 2 weeks to do mission trips and whatnot.
Hmm.
Then I'd want to do like 4 weeks off so I can go mission trip and then vacation in that country afterwards. Now I'm just wishing.
You can do it. You can definitely do it. Um, Another thing you brought up earlier, which I'd like to circle back on, you said something about it brought up to me like money mindset, or like
Mhm.
just you said like enjoying the fruits of your labor. Um, that's another thing I see all the time, like business owners that work so hard, but then are like afraid to share their success, or like be like, oh yeah, I went out and bought this nice car, or now I have this, nice
Mhm.
house. You mentioned like the guilt, like why do we feel guilty to be successful, or what happened in society that it's bad to be rich and wealthy? Because when I think of it, I'm like, I know you're the same. You support charities, I support charities. Like the more money I make, the more I have to give. And I feel like you're a generous person.
Yeah,
Obviously there's greed, right?
right.
But I
And let's also
also,
realize we're talking about us as small business owners. We are not, I'm not a billionaire or multi, like, you know what I mean? I'm just,
yeah,
we're,
yeah.
we're talking about, I have
But it's at every level, right? Whether
at
you're
every
a
level.
billionaire, a millionaire, or even just say you're, yeah, a successful small business owner, like what is it in our mindset that maybe it's how we were raised, or maybe it's cultural, which, are probably good points to bring up.
Yeah,
But I feel like that's something I've also heard too, like, oh, I'm afraid to, I don't want to be flashy. And I'm like, well, do you want to be the doctor that pulls up in like a Ford Pinto? Like, what does that
right,
say about you, right? Like,
right,
and
right.
and and when did becoming successful turn into being something that was bad, or that was she should be feel guilty or shameful about?
Yeah, I don't know. I feel like some of it stems from, this is my opinion, straight up opinion, um, is, and part of this opinion is because of where I grew up also, which was in very rural Southwest Virginia. I grew up, again, like I said, in a privileged household. I think part of it is it's frowned upon because it's kind of like, oh, like you're the rich people that get to do other things, or like maybe there's snobbery for it, right? So
Hmm.
my that's part of it. But I think another part of it is, I'm losing my thought here a little bit, is just, especially for healthcare, I think more is, you're supposed to be just helping people.
Hmm.
Healthcare should just be everyone is entitled to it because of like our insurance situation. It ties back to that, I think, a lot, for
Mm,
at least for me, like, or you hear patients, right? Because no one goes to their steakhouse and complains about it, right? About having to pay X, like $50 for a steak, but like they don't want to pay $50 copay towards a
right.
health thing, right? And I think sometimes that kind of helps us shy away from it. Be like, oh man, like, well, if I show up with my fancy car, or if I show up, talking about my trip to Iceland without, and I do this without also pointing out that I've paid for it, it's basically free because of my points. That I got a lot because I have high overhead. So see what I do? I kind of like still am apologizing or
See, that's what I'm. Yeah,
but like even
but sh
I still can't just sit in it. I still tell my patients like, "Oh yes, I did that." But you know, people who aren't business owners, they aren't necessarily coming in here. They're like, "Oh yeah, like I went on this like 5-day vacation to Disney World, and that's like probably the same cost as my 10-day European vacation because Disney is so expensive." But like, it doesn't phase them. They mention it because it's normal. It's like, I feel, now I'm talking about myself. Sometimes I feel like it's normal for everyone else to save up and spend their money and do nice things for their families. But like, I do feel like sometimes I can't be as showy because
because you're a physician.
I don't know what it is. Because I'm the fear of it being like, oh, she's so flashy and rich and or whatever, or
But
like,
do you
I don't
also?
know. That's how I feel.
So this is good, Joanna, because I'm glad we're
Yeah.
having a little this is a little side note. This is a little therapy session
Little
between
therapy
doctor,
session. We'll
yeah, between
determine whether or not
doctors.
this goes. Well, this might
There,
not go into the podcast.
there are groups. There are groups for doctors because doctors are very stressed. This is our little therapy group. But like Joanna, you're an extremely generous person, right?
Yeah.
Like Warren Buffett. Like no one gets mad at Warren Buffett for making billions of dollars because he probably donates multi-millions of dollars
All the
to
things.
different charities everywhere,
All the things. Yeah.
right? Like,
Yeah.
so why should it be any different for you? You work your butt off. You
My butt off.
perform a phenomenal service. You help
Yeah.
all these peoples. You change all these people's lives. You also, it's not like you're taking all your success and
Right.
not giving it any of it away. I'm pretty sure you're spreading the wealth like we all do
Yeah.
because we all know how it was in the beginning. Like,
Yeah.
look at the story I just told about you helping me
Yeah.
helping Dr. Bobbio.
Yeah.
Look at that ripple effect, right? So
Right.
why do you have that? Why do you have that mindset?
Yeah. See,
Yeah.
it goes all back to, gosh, it is just what it is. It's
Okay.
not what it is. I'm working on it, but it is. It's probably a little bit of um the
Just guilt.
um
Like that's
guilt
why I was
mindset,
saying, is it
kind of
guilt
like,
from
I
like
don't
your
know.
childhood? Do you think it's a cultural
No,
thing?
I don't know. I think, I've talked to other women dentists about this, so now I might get into this a little bit, right?
Yeah.
Not really being raised up by the industry, we raise ourselves up,
Yeah.
right? For a long time, to be to be to be and actually I'll say this, you'll find it even within groups of women when we will judge the other woman for doing that, but we won't do it for a man. So I'm going to say it.
Mm,
There is a little bit of that like
gender.
gender thing. So, like a little bit of a patriarchy, right?
Yeah.
But it's not like anyone's doing it on purpose. It's not
Yeah.
like someone sitting here and being like, Joanna, you're not worth it because you're not a man. It's just like that is just the social narrative that we grow up in. Even the
Yeah.
strong Madeira girl in me, we know that we're still functioning in a society that there is a bit of a patriarchy there. Are we
Yeah.
allowed to talk about that? Like, that is,
Yeah.
I think it's a reality, and good or bad, name it so we can change it. And I have to do the work to say, I deserve to sit at this table,
Yeah. Absolutely.
right? Because I do. Send me the bill for the
Well, I appreciate you being open and honest about that. I know it was a tough question. I like to ask tough questions. So
No,
thanks for answering.
of course. And like, gosh, you don't want this to be like a business podcast where everyone talks about the same old stuff. Like,
Yeah, that's
you
awesome.
got the things that are going to help business owners
Yeah.
or how to deal with all that stuff.
Well, and I think I bring it up because I know in my background, I grew up with, my mom, grew up very poor and,
Hmm.
she
Hmm.
was raised by a single mom and that definitely, like, she was very frugal, when she raised, and I'm, one of three siblings. And, my dad had a decent government job, so he was like the stable rock. But
Yeah.
my mom definitely gave me my entrepreneurial spirit. Like, she
Yeah.
was just like, oh, I'm gonna go do a birthday party over here. I'm gonna get this, and then we're gonna take a train over here because I'm going to use it. And she was always just wheeling and dealing. Like
Yeah. I
if
love
that,
that.
my friends always tell me like if you could have just harnessed her energy, she could have taken over the world probably. But so I definitely get it from her. But I also got a lot of that, uh, money mindset,
Right.
to a negative extent, which I think over the years, owning my own business and then getting some very good coaching, like you mentioned you had as well. I feel like that really switched in my brain. Like, no, celebrate your wins,
Right.
celebrate your success. It's okay to, number one, it's okay to be successful because we are helping people, but also at the same time, enjoying it. Like, don't feel guilty for enjoying it. And I
Right.
feel like that my mom, I feel like growing up probably, there was probably some shame and some guilt around that,
Yeah.
where now I do see it more, just out and about, and that's just something that I've been working on. So I appreciate your opinion on
Yeah.
it. That's all.
And just listening to you there, it's triggering some of that thoughts on what I've learned is called kind of generational
Yeah.
like stuff. Is I think you're right though. Like my parents did leave the Philippines to come here, and I think there was a little bit of you really have to. They were humble, right? Like
Yeah.
I grew up privileged, but never flashy, right? My parents
Yeah.
did not have, they didn't show it, which is fine. And I don't feel like I show it in any really real way.
Hmm.
Um, in comparison to, what I would imagine. But um I think there is a bit of that, right?
Yeah.
Like I did see that in my parents and that was definitely instilled with me. So thank you for sharing that story so I can come back to that and
Yeah.
heal
Well,
that part of me a
Well,
little
this is we're just trying to heal people one podcast at a time. So,
bit at a time.
I'm gonna change the name to the Healing Podcast.
The
So,
healing
AK,
podcast,
thanks to
right?
Dr. Claustro. All
Yeah.
right. Well, with that, I really appreciate you being on. What message would you like to leave with our audience? Whether they're a business owner, whether they're looking to enter the dental field, what advice would you have them? You know, um, if you can sum it up into a few words.
I think right now, like I did not think of this. Enjoy your success. Just like Dr. Keith said, right? Enjoy your success. Be able to share that with the people around you and also acknowledge the people who are part of your success. And share what your um, experiences are to help others because in any industry, when even if it's within your own neighborhood, when everyone in your industry is thriving and doing well, it only raises it up. And I think that's especially true for, medical fields, right? Because there's a ton of us, but even for if you own a restaurant, like you want to support your restaurant. So celebrate your success by helping others reach that higher level also because it makes it better. It just makes everything a little bit more joyful and palpable.
Well, yeah, that's palpable to everyone who couldn't hear her. Palpable. Um, well, that's exactly. I love that you practice what you preach because that's exactly how you've influenced me, how you've influenced Dr. Bobbio, and
Yeah,
why you have the relationships you do now. Because
yeah,
it's power in numbers or whatever you
yeah,
want to call it. It's
yeah.
better with a community, right? We all,
It is.
I feel like, thrive community, right? And I totally agree. Dr. Claustro, is there anything exciting coming up in your practice? Anything you want to promote other than We Want? We all know about We Wander already,
No
but is there
wonder.
anything like how people could find you if they want, if they are looking for a dentist? Is there anything
Yes,
exciting coming up in your practice that you want to share with our
yes.
viewers?
I have brought on an amazing new associate, Dr. Rania, and she is fantastic. And we are all working as a team to really focus on truly being a functional cosmetic dental practice. So, whether at all ages, right? So, thinking about ways to help our patients function at their best, health wise, confidence wise, all in relationship to your oral health. So that's just really exciting. Follow me on Instagram, Joanna Claustro DMD. And that's it. Like, we're doing a ton of Invisalign. I don't know when this is coming out and published, so I won't say like when we are having a little like Invisalign promotion thing coming up, but I'm not going to mention when that is because this might be later. But that's it. Can
And
I
what
turn around and ask you a question?
you can, where can people find you? Tell them what web, like if they need a
Okay.
dentist, where do they go? What's
Oh,
the website?
oh my gosh. You can find me at claustrodental.com. I am very active on both Instagram and Facebook, Joanna Claustro DMD. I am on a lot of the local chat boards, so look out for me there. I get excited when people ask about questions in there so that I can share high quality information. Um, our phone number, 703 406 8600. We accept text messages. We are conveniently located
Okay.
adjacent to One Loud
Awesome.
Ashburn,
Ashburn, Virginia. All
Ashburn,
right.
Virginia.
Thank you so much for being on the show. Thank you
Thank you.
for entertaining us. What is your question you would like to ask me?
I would like to know,
Yeah.
what is your driving force for this podcast?
I want to spread light on business owners, how awesome it can be, the difficulties of it. I, you know, entrepreneurship. Now that Jasmine and I own four small businesses, I don't want to cry, but it's a lot of hard work.
You guys are crazy.
Yeah, yeah. So it's a lot of hard work, but I think um, it also brings a lot of, I'm a big advocate of promoting, local small businesses. Um, you know, I had no idea how much of an impact owning a small business would be on my life. And so I was like, we've got to start a podcast so we can shed light on what it's like to be a business owner, to be an entrepreneur. I think in the media, it's very sexy, it's very flashy, it's very, cool. But
Hmm.
like, y'all need to realize like the hard work we all do.
Hmm.
It is hard, right?
Hmm.
Joanna, actually, you had I say this to people all the time. So to our viewers, Joanna once told me, she's like, if you've got a good job with like a good salary and like good benefits, like do not start your own business. Like just keep it. Like, and I tell people that all the time.
Do it. It's so nice. It takes a certain level of grit and I was going to say courage, but it also takes a lot of courage to realize that it's not for you.
Yeah,
Right?
yeah,
Right? And
absolutely.
I don't think being a business owner should be like the status of like you've made it, like you are more successful than anyone else, because I could tell you there are many non-business owners who are plenty more successful in different ways than
Yeah.
Dr. Brassfield and I are.
I
And if
think what I really appreciate about small business entrepreneurship is, yes, people may think from the outside like that, it's super flashy and this, that, and the other. But like for me personally, and Joanne, I'd love to hear your insight on it. Like it's totally given me like y'all. I did not come from us. None of my dad worked for the government. My mom was like a teacher, but I did not come from like a small business or entrepreneurial background at all. So I had no idea what I was doing. And so what entrepreneurship and small business has taught me and why I want to have this podcast is like you can do it. It's changed me personally
Mhm.
so much. Just the confidence I have now to um, be able to do something that is like completely new and like when when everybody like doubts you,
Mhm.
um your family, your close friends, people who are like, "Are you sure you can do that? You can't do that." Or, "How are you going to do that? You don't have any money." Like
Mm-hmm.
the amount of personal change I've been able to accomplish has given me just, I mean, faith. Like I have now, stepped into faith more because of just the things I've been able to accomplish. Just the resilient, like you said, the resilience, the grit
Mm-hmm.
that small business and entrepreneurship gives people. I think it changes people's lives, and
Mm-hmm.
therefore, I think it's awesome.
I think it's awesome. And what I have to say is I'm excited for this podcast because what I've seen here just now, because I'm basically Oprah.
Yeah, you.
Also, just so you know, this is
Joanna's
not
making me
very
cry.
unlike what a new patient experiences is at my practice. Just so you know, like I value this. Like I really excited. So this is very similar to how I speak to patients. I'm not going to lie. This is how I speak to my patients. But what I really appreciate about this right now with your podcast, which I'm really excited about, is that you are bringing the human aspect of business ownership, the grit, the glory, the hard work, and your tears right now aren't tears of pain, which we've
No.
all had. It's pride. And it is, I think we should all absolutely be proud of the hard work that we put in, the our ability to survive those nights that I will say, like, crying in the dark in your bathroom,
Yeah,
right? Like, you survive that. You survive the hardships that owning a business has on your family, your relationships,
yeah,
right? Um, and really knowing what's noise and what's not noise.
yeah,
So I thank you for hopefully allowing even other business owners, but hopefully this reaches the general population too, because I feel small business owners do deserve people's patronage more than a larger corporation does when it comes to a lot of things and services. They employ, it's harder to employ people. We don't have the resources to have all like better pricing. We don't have the resources to have all the benefits, but you're supporting people who are honestly just like you in your community who are striving to do really, really well and who are striving to perform their services to its highest. They're all really, really kind. Okay, maybe not all, but you'll find them, right?
yeah.
Dr. Brassfield is genuinely one of the best humans I have ever come across. And I've met a lot of people. I met a lot of people.
Yeah, yeah, no, thank you so much for being on. And yeah, I mean, I think the goal of the podcast is just to shed a light on, how awesome business owners and entrepreneurs are and the services we provide. And you're right, it does affect others. I mean, our staff, I mean, you've had staff over the years and you've been able to affect them in a positive way. That's why I think investing in your team is so important, like you
Hmm.
mentioned, because, we may not have all the benefits in the 401ks and all the nice things that, the government contractors have or, the other big, huge corporations have, but we can still, I feel like give give to our not only our communities but our staff and our
Hmm.
clients as well. So thank you, Dr. Claustro, for being on the podcast.
Oh my gosh. It's all about being human.
You man. Oh,
Oh my gosh.
how
Did you
did it
see
know? How did it know to do that?
that?
Did mine do it?
What? Oh
I
my
didn't know
gosh.
it did
We're
that.
magicians. Oh my gosh.
Do it. Keep doing
That was
it.
the
Keep
best
doing
way
it.
to end this.
That was the
Oh
best.
my
Get
gosh.
your get
Listen.
your do your
Does this
heart.
do anything? I don't know.
All right. Thanks for watching our podcast, everybody.